Welcome to the deep dive. Today, we're getting into something called transference.
Yeah, it's that kind of unconscious thing where feelings about past relationships pop up in our current ones.
Exactly. And we've got some material here looking at how this works, not just in therapy, but also just out in the world.
Right. The goal is really to unpack it a bit, help you understand what's going on under the surface.
So, where did this all start, this idea of transference?
Well, the big name is Sigmund Freud. He noticed it back in his early work with psychoanalysis.
What did he see exactly?
He observed patients developing these really strong feelings toward him, the therapist, and these feelings didn't seem to fit the actual therapy relationship.
Okay.
Instead, they looked a lot like feelings they'd had towards, say, their parents or other really important figures from their childhood.
Ah, so they were sort of transferring those old feelings onto Freud.
Precisely. He saw they were unconsciously projecting these past emotional patterns onto him. It wasn't really about him.
Gotcha. So it's like the person in front of you becomes a stand-in for someone else from your past.
Exactly. And it can show up in different ways, like parental transference is a big one.
Meaning?
Meaning you might start relating to someone, maybe a boss, maybe a mentor like you, related to a parent, whether that was nurturing or, critical.
Okay. And you mentioned other types.
Yeah, there's also stuff like romantic transference, where maybe feelings of attraction or even idealizing someone come up unexpectedly.
You can definitely see how that would be significant, especially in therapy.
Oh, absolutely. In therapy, recognizing this transference is huge. It gives the therapist and eventually the patient a real window into their relational history and those ingrained patterns.
How does that help? Exactly.
Well, by looking at how the patient relates to the therapist, the transference, they can start to understand those automatic ways of connecting and how they play out outside therapy. It brings awareness.
And awareness is the first step to changing things, maybe.
That's the idea. Understanding the pattern lets you start to make different choices.
But like you said, it's not just in the therapy room. How does this transference stuff show up day to day?
Think about meeting someone new at work. Maybe they remind you, unconsciously, of an older sibling you always relied on.
Mm.
You might find yourself trusting them really quickly, maybe asking for their opinion more than others. Or, flip side, maybe someone has a tone that subtly reminds you of a critical teacher you had.
And you might get defensive, even if they haven't actually criticized you.
Exactly. That's transference potentially shaping your gut reaction.
That makes a lot of sense. Now, you mentioned therapy. Do all therapists focus on this in the same way, like psychodynamic versus cognitive?
Good question. There are differences. In psychodynamic therapy, transference is often really central. The therapist pays close attention to it, might even interpret it directly with the patient.
Okay.
Cognitive therapies, like CBT, they definitely acknowledge transference can happen, but their main focus tends to be more on specific thoughts and behaviors in the here and now.
So they see it, but it's maybe not the main tool they use.
Sort of. They might address it if it's getting in the way, but it's usually not the core engine of the therapy like it can be in psychodynamic work.
What happens if the transference gets really intense? Like
Yeah.
strong positive or negative feelings towards the therapist? How is that handled?
Yeah, that definitely happens. Therapists are trained for this. The absolute key is maintaining professional boundaries.
Yeah.
Very clear boundaries.
Right.
The therapist's job isn't to react personally, but to understand why those intense feelings are coming up. They see it as valuable information about the patient's inner world and past experiences.
So it's data, in a way, even if it feels difficult.
Exactly. It's seen as material to explore safely within the therapy, not something to act on or reciprocate.
So even really strong transference can actually be helpful.
Potentially, yes. When transference emerges, it often means the patient is really engaging, bringing their core relationship patterns right into the room where they can finally be looked at and understood.
And hopefully lead to healthier ways of relating later on.
That's the ultimate goal.
Is there a connection between, say, past trauma and the kinds of transference patterns someone might have?
Oh, definitely. Trauma can heavily influence transference.
Yeah.
Someone with a trauma history might experience really powerful transference reactions, maybe intense fear, mistrust, or even dependency.
Because new situations can trigger those old, unresolved feelings.
Precisely. New relationships can feel dangerous or fraught in ways that echo the past trauma. Understanding that link is crucial for trauma-informed therapy.
So how does a therapist even spot this? Is it obvious? What are they looking for?
It's not always a flashing light. They're looking for patterns, patterns in emotional reactions, how the patient interacts with them, recurring themes,
Like,
things like having a reaction that seems way bigger than the current situation warrants, or maybe strongly idealizing the therapist one week and devaluing them the next, or just unconsciously playing out dynamics that sound very familiar to past
these
relationships.
are the
Yeah,
clues.
those are signals that something deeper, likely transference, is going on.
Okay. So, wrapping this up, the big idea is that transference is this powerful unconscious force. We project old relationship stuff onto new people.
Yep, both inside the therapy room and out.
And understanding it, especially in therapy, can unlock some really valuable insights into why we feel and act the way we do in relationships.
Absolutely. It's a fundamental part of how we connect with
Oh,
others.
so here's a thought to leave you with. Think about a recent time you had a really strong reaction, positive or negative, to someone you don't know that well. Could that feeling maybe have its roots somewhere in your past? Just something to ponder. Thanks for joining our deep dive today.